A drug that is normally given to people with arthritis could help COVID patients. A major trial shows that when Tocilizumab is combined with the steroid Dexamethasone, it can cut by up to half the number of COVID patients dying in hospital. As our medical editor Fergus Walsh reports, the trials were carried out here in the UK.
Searching among existing medicines for any that can treat COVID has been a huge task. First, there was Dexamethasone. Now there's Tocilizumab. Together, they can dramatically improve survival for patients on oxygen.
Compared with a year ago, when we really did not know how to treat this disease, we now have two treatments. They both act on the immune system, Dexamethasone and Tocilizumab. Put them together and we reduce the risk of death by a third or even as much as a half in the sickest patients. That's great news.
Dexamethasone, a steroid, costs just £5, whereas the arthritis drug Tocilizumab at least £500 per patient. But that's still far less than the £2,000 a day cost of being in ICU.
This therapy looks like it keeps people out of the intensive care unit, so they never need to meet people like me, which can only be a good thing. So as well as improving survival, it actually will decrease the number of people who need to come to intensive care, which is fabulous.
There's understandably a huge focus on preventing coronavirus and vaccines. But for those with COVID, it is treatments like Dexamethasone and Tocilizumab which will save lives now.
And they need the research, so I just signed up for them.
Lawrence spent several days in intensive care at Addenbrooke's Hospital in Cambridge, but now has his bags packed, ready to go home. He's one of tens of thousands of COVID patients taking part in NHS trials.
If nobody's willing to try, you're back to square one again, aren't you? Nobody's going to do anything.
Last month, NHS hospitals treated more than 100,000 COVID patients. That's around 1 in 3 of all those admitted since the pandemic began. COVID remains a brutal disease, but the chances of surviving it are improving. Fergus Walsh, BBC News.